Hi, Melanie. Welcome to the show.
Hi, Brittany. Thanks so much for having me.
It is a pleasure to have you on. I've known you for years now, but I feel like we haven't had it in a while. And so I'm really excited about just getting an update from you on what you're working on, what you're doing, but also an update on the industry because there's been so many juicy publications coming out recently on the vaginal microbiome. So, really excited to jump into this today.
Me too.
Let's kick it off with telling us and the listeners more about you and your background.
My name's Melanie Santos, and I am a urogynecologist. Our term now is urogynecology and reconstructive pelvic surgery. And basically, people like me do a residency in either OBGYN or urology, and then do a subspecialty fellowship in our specialty of pelvic reconstructive surgery. And I love what I do every day, minutes of work to make a huge change in a woman's life in their typical pelvic concerns, things like bladder control, bowel control, pelvic pain, prolapse, lots of different things, making really just big quality of life improvements for my patients, which I love. And my work with that, I also am the medical director at my hospital for pelvic health and even work focusing on women's health for the Providence healthcare system. We're really expanding our women's health work, which I know you're interested in. And so that's also been just a huge passion of mine with women's health. And so that's why I'm excited to talk to you today about my work as a chief medical officer of Cern Corporation, where we are working to help improve women's health, specifically with women suffering from vaginitis.
Wow. I don't know why all of a sudden I had this kind of overwhelming feeling of the pelvic floor includes it all. It's like the skin, it's the muscle, it's bone, it's injury, it's tension of muscles and fitness, but it's bacteria and viruses and infection and pleasure and urine and feces. And actually, it's like a lot of things right there.
Yeah, I just saw a patient yesterday post-op and she's super happy and she was like, you can't, it's really, I really appreciate it when patients are so excited and happy for, and you've brought me back my life. And I was saying, yeah, you know what, this is your moneymaker, lady. This is where you had your children. This is where you're the most intimate with the most important person in your life. This is where you have your daily functions every day, bladder, bowel, just keeping your body in check. And just to make a change to make that normal for you, that's why we're here. And she's like,
Yeah, no offense to like foot surgeons. No offense, but like we could cut off your foot and like you can still live a really fulfilling life, but like you can't really remove the pelvic floor. Wow, I don't know why. I've been talking about the pelvic floor for 5 years now, but I just had this sense right now that I was like, it's the holy grail of all the things.
It really
Yeah.
is. Even for the other parts, right? Our breast, it starts, they're modulated by the hormones in your ovaries. This is really our source of
It's
everything.
the epicenter. It is the epicenter. Whoa. You started a pelvic floor health program at St. Jude's Medical Center. Tell us a little bit about that. Like, why did you start it? What does it do? And do all medical centers have a pelvic floor program, or is this kind of unique?
Great question. A lot of women have pelvic floor disorders. And there was a study that's, there was like in regards to the number of millions of women, 30 million women who have at least one pelvic floor disorder. If you spread out, which there's only about 2,000 of us in the country, if you spread us out equally, we'd each almost have to have 27,000 patients, which is
Oh my God.
possible. And so at our center, we're blessed to have two of us, but the wait times are long. This is a complex, as we've already talked about, a complex area which doesn't just deal with the vagina, but we're dealing with bladder, bowel function, the impacts of that and the problems on your mental health, your chronic pain, lots of different things. So I wanted to create a more comprehensive pelvic health center to take the best care of our patients. So we have combined 11 subspecialties, which is things like my profession of urogynecology with OBGYN, gastroenterology, colorectal surgery, pain management, pelvic floor physical therapy, psychotherapy, nutrition, and also even integrative medicine, all these things to just help women because it's all connected. If I have a patient who gets referred for urinary incontinence, 80% of the time they have other things like prolapse or bladder issues, bowel issues, pardon me, or pain. So we want to work together to optimize things for the patient because it is so connected. So this is a way for us all to just communicate, get the patient the best care, figure out exactly what they need because it's hard for them to talk to their doctor about it sometimes. They're embarrassed to say they may have some other problems. So we can have our navigator speak to them and then it just really improves care. And not every hospital has a pelvic health center. I actually emulated our program from from the program at Stanford where I did my residency because I really love their program we had there. But it's really just the best way to take care of these complex problems we have for patients and take the best care of them quickly.
We know that there's a lot of maternity wards being shut down around the country because birth actually is not a moneymaker for hospitals. And in fact, it's a money cost because of how expensive it is for all the different people that you need to birth a child. You need nurses, you need anesthesiologists and neurologists and cardiologists, and then a gynecologist and obstetricians. Pelvic floor, is that kind of a similar issue or where you need a lot of people, but there's not a lot of reimbursement? Are you finding that the hospital system that you're working at is actually quite excited and happy about how the program is running in terms of business model?
I do think they appreciate it. It has really expanded our program to the point where within the Providence system in Southern California, we're the regional center of excellence for pelvic health because we just have the highest volume because we can take the best care of patients with things like this program. And so they're seeing that in our Providence healthcare system. We also are creating other centers like this. And there's even some women's health and wellness institutes, higher up levels, advanced care in our system. So they do know it's important. And I think you probably know just the words today, women are really getting more vocal, their concerns and what they need, especially with things like with menopause. And we're getting our system to understand there's more to a woman's life than 10 months when she's having a baby, and that you really need to take care of them the whole time, as well as our population's aging, more of these pelvic concerns and just medical concerns for women that can be very different than a man are going to be increased. And we need to be able to provide that best care for them and have the resources to do it.
Yeah, I've noticed definitely a change in our perception of how normal urinary incontinence is, right? Where it was, oh, that's just what happens after you have a child or as you age, you're going to sneeze, you're going to laugh, you're going to pee yourself. That's your life. Deal with it. It's called being a woman. Welcome. And today it's no, actually, that is a medical condition that deserves and needs addressing because when we encourage you to exercise for the rest of your life and you don't want to exercise because every time you jump or step or move, you leak. All of a sudden, then you become overweight, then you get diabetes, and then you have heart disease, and right. And it all started with Kegels, like at its most finite, rudimentary version, but it actually has these huge lifelong consequences. Are you seeing that shift from, oh, this is just being a woman to every stakeholder, woman, doctor, billing codes saying this is actually something we need to address?
I am not. I will still get the patient that tells me I waited so long. I addressed this with my doctor and they're embarrassed to talk about it. And they actually brought it up and got the response of, oh, of course you leak urine. You had those 5 kids. That happens. Or if they have some prolapse dropping, they haven't, of course you have that. It's still happening today. Now we are getting through. Whenever I do talks and things, I'm always about you to the patients and to the community. It's like you don't have to live with it. Yes, it happens, does not mean it's normal. And the treatments, my God, they are so simple. And when you think of, say, for urinary incontinence, the average woman waits almost 8 years to address it. I love, in regards to what you're talking about, how people are not dealing with it as long anymore. Yes, I love seeing these younger and younger patients coming in. They're done. Actually, I had a family member just text me the last night. She's like, hey, I'm done with the kids. What do I do now? And so I'm getting her hooked up where she is with what she needs because good. And she's 30s. Great. You're done with your kids. Let's go. She wants to
Yeah.
get on with her life.
Yeah, yeah.
And
For
not,
those listening who may be like, wait, urinary incontinence is not, I can address this. And you just said there's some simple solutions. What are some simple solutions?
so there's different types of incontinence, but the most common types you'll see in the younger patients are stress incontinence, which is typically from damage to the urethra. That baby can insert how many pounds that beautiful child of yours was when you had them, can damage the tissues as they're coming out of your beautiful little vagina. So when that happens, they start leaking with activity, and there are a lot of different treatments, but the gold standard sling takes about 15 minutes to do. You just leave the hospital, you have immediate improvement, minimal restrictions afterwards. And I think I need to just put it up on my walls in my office because often they'll just be like, that was it. That was it. That's all I had to do. Yeah.
Wow. Okay, great. Yeah. In FemTech, we're seeing a lot of over-the-counter devices for muscle strengthening, right, and repair. But I'm also hearing you say that the medical procedure is actually pretty low hanging fruit in terms of an experience.
Correct,
Mm.
correct. And some people, everyone has their choices. When I talk to my patients, we talk about this is quality of life. You have choices here because this is different from other things of medicine. This is quality life medicine. You can make a choice of what you want to do. And some patients don't want surgery. That's just not in the books for them. Perfectly reasonable. We do have these alternative treatments. Some patients want to do the work. They want to do the physical therapy. They want to do their part. Some people can't. They may have actually had some damage at the time of delivery where their muscles just aren't going to work anymore. And so it's really about what they want to do. And it's so wonderful. Yes, we have wonderful new technology. I love how so much is coming out in the public health arena right now, as you've already mentioned. So patients have those choices. And I love giving my patients all the choices. I have a meeting in a few weeks for another new device for stress incontinence, a temporary device, because if my patients want that as their choice, I want to be able to offer that to them.
Yeah. Speaking of technology, that's a great segue into talking about Cern. So you're involved with a startup, an amazing startup that I've been following and super impressed with the data. Every time I meet with the CEO, I'm like, wait, what is it showing? Oh my God. So what is Cern? What does it do? What problem is it addressing?
The Cern device is an intravaginal device that uses simple visible light to treat vaginitis. Now, vaginitis, as you already know, is a huge problem in the world and in this country. In the United States, it is the number one reason why any premenopausal woman will go see their doctor. It's the number one reason premenopausal women go to the emergency room. It is the most common problem for women. And we're focusing on two of the most common infections in regards to yeast and bacterial vaginosis. And so simply what we've created is this device where you put the device in, use a light treatment for a period of time, and then it'll help resolve your infection without the use of any drugs. We're just so excited about it, and just the different changes we could also make with it to treat other symptoms and problems too in the future.
So what I'm hearing you saying is that the most common medical concern for premenopausal women is infections in the vagina, which is either yeast or BV, which if you're a vulva owner listening, you're like, yeah, been there, have had one. Yes. And that this is a small, and from the images I've seen, it almost looks like I want to say a bullet, but I don't know if that actually makes sense. But it's just a small little physical device that you would insert into the vagina, and it has UV light that is safe for your vagina, but kills the bad bacteria or readjust the levels of how much bad compared to good is in the microbiome of the vagina, and that would essentially treat the infection. Did I get that right?
You did, but we don't use UV. We're using
Oh,
light. It's lower, so you don't have less of that concern with UV. We all know
yeah.
about ultraviolet light. We're always trying to
Yeah.
hide away from that. So we don't need UV. We're able to determine safer visible light spectrum levels to use in the vagina. And what we did was in our lab studies, we found out the different durations of time that would be needed. 60 minutes for yeast, 30 minutes for BV. And we saw that we could treat these problems, logarithmic differences, without causing any significant harm to the good bacteria, lactobacillus, in the vagina. We
Yeah.
also saw that it's really great and safe where we looked at the adjacent vaginal mucosa cells and there wasn't damage or death of those either. So it's something that's really just taking care of the problem without causing significant adverse effects, unlike a lot of things we do, which is including the gold standard treatments of medical therapy for these problems.
I actually wanted to ask you about that because what it sounds like is that it's different from with the current treatment, which is antibiotics, which just kills everything. Can you tell us about what is the current treatment?
Yes. So for yeast, current treatments are azole antifungal medications, and most people will use the oral is simpler for them. There is a transvaginal form as well. And then, yes, antibiotics are used for bacterial vaginosis, which is really just an alteration of the normal bacterial flora there. Most people take oral medicines because it's simpler for them. And the struggle with that is only about 2% of the drug gets to the organ of choice. So that's why we need certain dosages. And that's why you see all of these adverse effects that they have. Most commonly, they are having GI upset because it's affecting that good gut microbiome that we all already know very much about. It's causing all these alterations. So the way medicine works is it attacks the problem. The way our device is working, it's much more like integrative medicine, which I love as well. It's we're going from a dysbiosis to a symbiosis. We're just bringing balance without those adverse effects that you get with medications.
And recurring BV and recurring yeast infection is really prevalent issue. How many women does that affect?
There was a study from the CDC for recurrent yeast vaginitis that said almost 8 million women, but their definition was these women had to have presented to a doctor or a provider about 4 times that year. And I think you and I both know we don't always go see the doctor. We are constantly home treating, over the counter remedies, things we see on social media, different things we're trying to do because we don't want to see the doctor. We don't have time to see the doctor. We may not even have access to the doctor. And so those numbers are just so low. So just think of that exploded. And it's the same thing with BV. 30% of premenopausal women have this problem, and it's worse with pregnancy and can really cause other implications as well. And a lot of the time, they don't even really feel they have that there, which is frightening because then it can ascend and cause worsening problems in the future. So a huge problem. The majority of our population deals with this. So we're excited to be able to bring something that they can do, they can use it, and they can reuse it.
Yeah.
It's just a continued treatment you can have at home.
Yeah, I'm not supposed to have favorites in FemTech, but you're on the list. I'll admit, you're like top 10 favorite out of 1,600 companies, top 10, because I think that this is that low-hanging fruit that's if we solved this for women, like game changer, right? For the healthcare system in terms of who they're treating, who they're spending time seeing. If we had a remedy that was just helping this and then doctors could spend their time on other things, like and then also the quality of life, like it goes on and on. In fact, in my vaginal and urinary health chapter of Unlocking Women's Health, I cite that 62% of women mistake a BV infection for a yeast infection. And BV is bacteria, yeast is a eukaryotic cell. It's actually quite different organisms. And so 62% of women are mistaking BV for yeast. What are the consequences of this misdiagnosis?
They're just going to they're getting unnecessary treatment. They're going to start to develop resistance. They're going to have unnecessary adverse effects. If you prolong and not recognize the proper treatment, it can cause worsening infection. The list is so long. What I love about our device, Brittany, is we're taking care of both. And so we're actually in our first clinical trial for this. And we're seeing a lot of patients who have both problems. So you have one and you may have the other, or you may have both. Don't even really know. And the patients present and they have their perceptions, they see the results, they're like, oh, okay. And the best part that I love about the Cern device is that we're treating both, and it really just works on timing. So say you're home and you have a vaginal infection and you don't know, is this that my BV again, or is it yeast? I'm not really sure. You just do the treatment for both and
Wow.
you're covered. And again, not the adverse effects, and it's much simpler to use. And you mentioned the impact on our healthcare system. I'm excited about the impact on the world, because think of people who don't have access to healthcare, and you can get these devices to them. We've had interest from the military. I can think of a patient of mine, and she had recurrent vaginitis and she was going to Afghanistan, and I just loaded her up with diflucan. I'm like, good luck. She didn't know when she was coming back. We didn't really know what was going to happen. To have these types of things that you have access when you just don't have any access to healthcare, and huge. So
Huge. And anyone who's ever done like a sports summer camp week and you're sweaty for literally the 12 hours of that day, imagine being in the military gear, not breathable, you're not going to have some great toilet paper or washing or bidets to help yourself. It's a pressure cooker, hot pot of bacteria and yeast. And wow. Another statistic I heard about was that over half of preterm birth are due to a BV infection. I was like, whoa, wait, what? Preemies in the NICU are due to a vaginal infection? Can you talk a little bit more about that?
yeah, the prevalence we already know is high 30%, and it's even higher by 7% more in pregnancy and 30%. So a third of those women don't feel it. They are asymptomatic. That's 2.5 million women on average a year. And yes, like we talked about, an unknown infection can cause ascending infection. It can cause problems, and that's an infection is the most common reason for preterm labor.
Talk about healthcare costs and life-saving things. Like this is super serious. And then research came out last week. This is for the moment question. Research came out last week showing that BV is an STI, sexually transmitted infection, that BV is only affecting sexually active women. Do you see this in your practice? And what do you think about that kind of mindset switch between BV is, oh, you're just imbalanced versus when you have sex, the sex activity is what is imbalancing it. And in that research, if I may continue, is the research, what they showed was that when the male partners of these women who had recurring BV, they took antibiotics, she stopped getting infection. And so that's how they were showing that this is an STI. Can you speak a little bit about that?
With all of these types of infections, it's transdermal, right? It's touch to touch. You touch someone else and you get the infection. So they're touching, and that's how they're spreading it. And we see it with yeast too. That's why we always start to treat the partner. And yeah, it's going to be interesting. Are we going to start to give them some, maybe you have to make the device in a different shape?
A little hat, a little penile hat. I love it. I'm all for it. If we need to treat men to improve women's health, I'm all for it.
Absolutely, right? HPV vaccine first, Cern device for boys next.
Yep, that's right. And I can't, okay, I can't help myself but bring that up. I am on this like train right now around this, once that research came out, rethinking, okay, BV is like, treat the woman. And now we need to open our perception, take off the blindfolds and say, wow, we may actually have to treat her female or male partner because they already know female and female BV is being transferred. This is novel that it's from the male as well. But then when we think about HPV, we're always thinking cervical cancer. And yes, the public kind of knows that head, neck, and throat in men is caused by HPV, but like we're not having the conversation, at least I'm not hearing it openly, that is from oral sex with women who have HPV in their vagina. And there's something like that is just, we can maybe get around this idea of intercourse, but oral sex causing cancer, that's like untouchable. Like, how do you sleep at night with that? Like, what do you think about that?
Right? Touch means touch. It's a contact infection. So whatever y'all are touching, depending on the mucosal and the integrity layer, that's going to increase it for sure.
Yeah, yeah. Another researcher I cited in my book is Dr. Melissa Herbst-Krolowitz, and she is a researcher at University of Arizona studying the vaginal microbiome. And she told us about the estrobolome, a collection of gut bacteria that process estrogen. So my question to you is, how much hormone imbalance in our bodies as females do you think is actually connected to our gut health?
It's a great question, and I'm not really sure. The estrogen in our body, it's so complex. People think it's just from your ovaries, but it's not. We have so much from other things like the adipose tissue, and even on the skin, you'll have some. And there's so many different locations. The adrenal glands will make it, and there's crossover between the estrogen and the testosterone, and all the implications on all the different organs, not just our sexual function, but on the brain for cognition, and your liver for cholesterol, which affects your atherosclerosis and cardiac disease, and just everywhere it's affecting. So I think the bacteria, we're just learning so much more now. We know a lot about the gut microbiome. As a urogynecologist, I'm really super interested in the biomes. We've been working on the urinary microbiome much more for a longer time than we have on the vaginal. But I think it's really important to learn all of these areas that are all integrated. This is what I deal with urogyne, right? Bladder, bowel, pelvis. All of this is all connected. It's all connected. So
Yeah.
we learn, the more we're going to be able to understand how these biomes are impacting on other things, such as our sex hormones, of course.
It's almost like three countries, right? You have the urinary country, the vaginal country, rectal country, gut country, right? And like, what are the politics happening between, what is the trade routes? Is there invasion, right? You could actually make a whole war analogy. Let's talk about global peace, global peace being the goal.
Harmony, biomes in harmony.
Binos in harmony. I'm going to ask you something that I love to ask the gut microbiome folks, which is we have in the last 10 to 20 years discovered that so many conditions are affected by our gut, even things like depression or maybe autism is because of the gut and our bacteria in our gut. And I think to myself, has anyone been checking whether or not leaky gut, is there leaky vagina? Are the bacteria in our vagina affecting our brains? Is the gut, have you heard that conversation starting to happen yet?
I honestly haven't. I think what we're just most excited about, quite honestly, for the vaginal microbiome is figuring out what it is. There's a few different companies working on it. I'm working on it with some people as well. So excited because I think you got to learn you have to understand what you're dealing with So then you can figure out what's right, what's wrong, and how to make things better for them. So I think that's our focus right now. Even we're doing some elucidation. We've done it in the urinary biome, looking at things like dementia and differences in the biome, that we are looking at certain things for that. But I think that's because we're a little further along in that area.
Yeah, yeah. That kind of reminds me of Juno Bio. Juno Bio is a vaginal microbiome sequencing company featured in the book. And literally their first product is just let's sequence, meaning let's figure out what is in your which bacteria and at what levels are in your vaginal microbiome. And that itself is the product for right now, because we need enough of that data to even start to figure out like, oh, wow, this subset of women who are struggling with recurring BV, turns out they always have this bacteria in really low amounts. And turns out taking vitamin D will increase that, right? And then we get to the solution part. But so much of women's health is we're at square one. We're like square one, trying to figure out what is even there. We're taking the first census. I don't know why I'm like so political today. We're taking the first ever census of this vaginal microbiome. Are you excited about companies like this, the vaginal microbiome at home sequencing companies?
So excited. It's so important. And yeah, and I hear you. And sometimes it'll make me really frustrated when we're just really on just starting all of this work. But then it's like when I tell my patients, they're like, oh my God, what? Just we're here now. We're doing the work. We're going to get the answers. Let's just be excited about that.
Yeah, yeah. And as we learn more, we're starting to realize there's certain products and things in the market that are not ideal for the vaginal microbiome. And if you are a vulva owner, you likely have heard about this or already know about it, that certain yoga pants or certain types of shorts or underwear not conducive to good airflow, and therefore you know that you're not feeling well after. Maybe you have more discharge or itch or odor or end up with an infection. Or there's also washes and the history of using douches. So can you talk to us a little bit as a physician, how do you balance telling your patients, that when they feel good about themselves, when they're using vaginal washes, they feel fresh, but you're like, oh my gosh, you're actually hurting your microbiome. Like, how do you balance that conversation?
That's a great question. And I always think knowledge is power. And I have really long conversations because I want them to understand. Because if they understand what's going on, they will be proactive and they will want to do the best thing for themselves and not just go to the quick fix. I mean, all the time, because even with the surgeries we have, I always tell them you have options here, but I want you to be empowered to know what you're dealing with. You would probably be surprised at how many patients I see. They had a surgery. What surgery did you have? I don't know. They did whatever they said they were going to do. I'm like, but you need to know what was done to your body. That's your body. And so the same thing when they're talking about these things, and it's just educating them, right? The vagina cleans itself. You don't need to put extra things to make it smell pretty. And talking to them why it can harm them with the chemicals, changing the pH levels, stripping away the flora, causing harm like that, and how in the long run it can make a bigger problem for them in the future. And when you empower them and not only tell them why, but give them the proper alternatives that they can use, safer, more organic things that really just keep a good pH level. I tell them if you treat the real problem, which may be the atrophy or the adjustments in pH for whatever reason, then your problem will get better, but we can have some other products that'll help you even more if you need to, but they're safer for you to use. So I really just think it's about knowledge, getting them to understand so they can understand why they're making the choices that they're making.
Yeah. Something I was really shocked about when I was researching for that chapter was I came across a study showing that women of color, in particular Black and brown women in the United States, are disproportionately purchasing vaginal soaps, douches, wipes, and washes. So, like, statistically significantly much more in those communities than white women. And doing the research, turns out historically, marketing companies were targeting these women of color, saying, you smell bad as a Black woman, and that is why you need this. You need to smell better. And thank goodness that is no longer the case today. The marketing has been held accountable, and there's no more of this racist marketing, at least not like explicitly. And yet there is this almost like this heritage, this culture of, hey, I'm a daughter of a Black mother, and in our shower there's a vaginal soap, and I know my mom uses that, and so that must be what women use, right? So I'm going to use it. So even though there's no more ads targeting this young Black girl, she's in a household where her mother might have been converted to a user, and now she, as the daughter, is convinced, oh, I must use that. And so what's your 2 cents, what's your opinion on that conversation around educating specifically women of color that they don't need these products?
Yeah, I think that health disparity has been a long time, and we're already making changes and improvements in this. And there's more in our field, there's more Black women doctors, more Black gynecologist women.
Mm,
You want to see who you are, right? You want to have
yeah.
a connection with who you're seeing. And so I love seeing my friends who are really empowering. I empower my Filipino ladies all the time, right? But it's just about empowering your people to know that these cultural things we grew up with are just that, and they're not really necessary, they're not real, and you can make these changes. And again, knowledge is power. Educating them, making them, getting them to understand, and finding the right people that they'll listen to so that they'll get the proper care that they need and do the things better for their bodies and not harm themselves because of things that their mom or their grandma did.
Yeah. Yeah. Melanie, you are a game changer for women worldwide, not just in your community, being involved hands-on with your patients, but also working with tech companies and coming on shows like this to speak your truth and your knowledge and share that with our listeners. We are so grateful for all the effort because I think right now a lot of people in women's health are feeling really tired. And so I know a lot of listeners are coming to the show for some inspiration and for uplift. And I hope that, and I feel after this interview, there is hope. We're headed in the right direction. This is a season of potential setbacks or confusion, but you know what? Pelvic floors aren't going away.
Nuh-uh.
They're not going away. And so we're going to continue to work on it. And with leaders like you, I think we're in good hands. So thank you so much for your time today.
Thank you so much for having me. I appreciate it.